The experts say this year's Atlantic hurricane season will be less active than average. But as we all in the Caribbean know and have experienced, it only takes one system to turn the lives of a population upside down. And the impact of a storm or hurricane is not limited to damage to infrastructure. The physical and mental health are also affected by the loss which these dangerous systems can cause, as we hear from Barbados' Minister of Health and Wellness, Jeffrey Bostic.
The psychological impact of such devastation, including loss of life in some instances, cannot be overlooked. Immediate and focused interventions are needed to assist individuals to cope with loss and devastation, and to provide the tools to emotionally support individuals and their families in the eventual transition to normalcy or a new norm.
And Lieutenant Colonel Bostic knows what he's talking about. He served for 25 years in the Barbados Defense Force and has been part of teams responding to natural disasters in other Caribbean islands.
I recall in Grenada, after the aftermath of Hurricane Ivan, seeing Grenadians of all walks of life walking around with rum bottles, whiskey bottles in their hand, and not doing anything at all to help themselves. And at that time, I did not recognize that those poor people were in shock and had experienced a trauma that we would never ever like to experience ourselves. Similarly, after the volcano eruption in Montserrat, I was there on a reconnaissance mission, and it touched me profoundly to stand at the top of a hill and look down to the capital city, looking up to see that city under ash. And in several buildings covered by ash. That affected me. And only last year, hosting a family from Dominica at my house for 2 weeks just to get them away from what was going on there. And a young girl, 6 years old, each time the rain fell, each time something hit on the top of the roof, she was disturbed. This is a serious, serious thing.
The Health and Wellness Minister was speaking at a training of trainers workshop in Barbados last week, which PAHO hosted with the aim of establishing a roster of persons who can be mobilized to affected countries in the event of a natural disaster to provide mental health and psychosocial support. Given the magnitude and frequency of storms affecting the region in recent times, Bostic says his government, as do others in the region, need to ensure they're ready for a mass crisis scenario.
The importance of having an adequate mental health system prior to an emergency situation becomes a national priority for disaster reduction. The capacity of a country to mobilize existing resources efficiently and effectively to organize an adequate mental health response will depend on the strength of its community-based mental health system and the existence of adequate policies, plans and legislation. A mental health component, therefore, has to be part of the National Health Sector Plan.
The minister admitted there are deficiencies in Barbados, with the country's mental health facilities incapable of coping with the resulting trauma of a major natural disaster. But he says his government is moving to correct that. Dawn Paris for Newsline Health.